It's funny, I was born in Wichita, Kansas, and then I moved to Florida when I was 4 years old, so I feel a little bit of a kind of full circle moment coming back, but I'm really excited about being at the University of Kansas because I already feel like there's such a sense of community here. The community health program is a little bit smaller than some of our other department programs, which allows us to have a really intimate and personal feeling in the classroom, and that's been something that's really excited, and I'm hoping to grow that a little bit and allow us to continue to make connections and relationships between our instructors and faculty, the community, and our students. But when I interviewed here, I really felt a sense of authenticity from the faculty that I had the opportunity to meet. I felt a sense of collaboration and connection with the other community health faculty members. And then I also think there's a lot of excitement and homeliness of Kansas, and the people are proud to be from this area, and I was really excited to be part of the Jayhawk community because of that. I think my #1 priority when I enter a classroom space is creating an authentic environment which students feel welcome, safe, and comfortable to be themselves, because I think when we've only achieved that can we actually learn about curriculum and the content we want you all to know as proficient community health leaders. And so first and foremost, I really like to cultivate and foster that environment for students, and a lot of that it is from being open with each other, being transparent with students, also allowing them to feel empowered to have their voice heard. And so I think that also speaks to my teaching philosophy, which is that I want to co-construct this environment, and I also believe in having students have some agency in how we are learning this content, as well as creating a space where we're going through the process where they can ask open-ended questions in the application of what we're doing. So I study how we best translate this within a classroom because community health is such a service-oriented profession. And so how do we create something that is applicable and that we're doing and we're living into the classroom so that you all are not only seeing that you're byproducts of community health, but you are influences on community health outcomes. Because my interests are community health education, students keep me going, but I also think health equity, making sure that all populations and all people are able to achieve their healthiest within their lifespan is particularly important to me, and I feel that that's tied to a lot of social justice issues, and so bringing in social justice, social determinants of health, all to achieve health equity are ultimately what keep me in the community health sphere. I went to the University of Florida for my bachelor's of public health, my master's of public health, and my PhD in public health, so I am a triple gator. I am a big fantasy fiction reader. I also enjoy being outside, so things like hikes, going to the park with my daughter and my husband. We also enjoy going to breweries, so that is how I have gotten to know the Kansas and Kansas City area, is trying breweries all across the region, and I have at this point I think tried 15 of them, and so beer festivals, breweries are probably my favorite pastime at the moment. I would say I'm a little bit of an adventure junkie. I've gone skydiving, I've done zip lining, I've done whitewater rafting, so I tend to do some of those more fun adventure sports, which I think doesn't always read when someone meets me initially. So enjoying kind of just the adrenaline spikes are probably my fun fact.